Yep.
This is Sue Milius, and she is a nuclear medicine and radiology technologist at St. Luke's Hospital in Cedar Rapids, Iowa. Hi, Sue.
Hi.
Will you please just tell me how you decided to pursue a career in medicine?
Well, many years ago, I wanted to do something in the medical field, but I didn't want to do run-of-the-mill nursing. I didn't want to go from patient room to patient room to patient room. I wanted to do something where I could get more of a relationship with my patients. So I went initially to radiology training, which is a 24-month degree that nowadays you can get a 4-year degree or an associate's degree. They offer both. And I did that many years ago and worked in general radiology for many years. But when you're in general radiology, then that opens the door for you to look into ultrasound, CAT scanning, MRI, or nuclear medicine. So for the last 28 years, I have gone back and learned nuclear medicine, and I've just worked in the nuclear medicine department.
That's awesome. Did you consider anything else in high school before that?
Just nursing. Nursing was the other thing that I looked at.
Mm-hmm. And would you alter your decisions now if you were making them today?
I would. I would go into nursing probably, or instead of specializing in nuclear medicine, I might specialize in ultrasound. Ultrasound is jobs everywhere. It doesn't use radiology. It uses sound waves instead of radioactive isotopes or X-ray beams. So there's no radiation involved. Doctors are more eager to utilize it, and it's become second nature. So I would probably, if I was starting all over, go into ultrasound or nursing.
Okay. What are the duties of your job?
Well, in nuclear medicine, we use radioactive isotopes and tag them with a little bit of chemistry to a molecule that goes to a certain body function. And then we inject it most of the time into the bloodstream, or in some cases they take a pill, but we get it into their body, and then we can see where it goes. So we can look at the function of a certain organ based on where the isotope goes by the molecule that's carrying it.
Wow, that's cool. What do you like the best about your job?
Patient relationship. Mm-hmm. A lot of our exams take a couple of hours, and you have an opportunity to visit with patients and build a rapport with them and maybe make a difference. There's really nothing in nuclear medicine that you do that is a 5 or 10 minute deal. Everything is 1 or 2 visits. Sometimes the exam goes over several days.
Okay. And what are some things that you don't like about your job?
Well, there's call involved. So anything in the radiology field pretty much involves call. So that means you go home at night and you're with your family, and then something comes into the emergency room and they need you, so you have to go back to the hospital. So that would be the thing that I probably dislike the most.
Okay. What kind of education did you get? I know you talked about how kids can get college education, or have to actually, right, to be licensed. Is that how it works? Or?
Yes. You have to have at least an associate's degree, and now there are some states that are requiring a bachelor's degree to be licensed. For sure, you would need an associate's degree or a bachelor's degree to do really any kind of radiation now. Meaning CAT scan, MRI, mm-hmm. general radiology, or nuclear medicine. And most nuclear medicine programs now are bachelor's degrees.
Okay. And how do you coordinate your family life and your home and your job responsibilities?
Well, you need to have... I always had a husband that was supportive of me, so when I went to work or was on call, you have to make sure that the other person is there to care for your children or go to their events if you're tied up at the hospital. It's a long day. I currently commute to the hospital I work at. I live about 65 miles from the hospital, so I get up in the morning about 4:30 and leave the house and have to be at work by between 7 and 7:30 in the morning, and then work until 4 or 4:30 in the afternoon, and then get in the car and drive home. On the nights that I'm on call, I have to actually stay away from my home in in Cedar Rapids to be a half hour from the hospital.
And why do you choose to do that?
Because the money is good.
Okay. So that's one of the benefits of the job for sure is the salary that you earn.
Yeah. Nuclear medicine technologists have considerably almost double the wage of general radiology person.
Okay. And what is one piece of advice you would give to a high schooler who is considering nuclear medicine or radiology?
Make sure that you have compassion for people. If you don't feel compassion for people and don't want to take the time to care for people, then you should not be in the medical field at all.
Very good. Thank you so much, Sue.
You're welcome.